Hello, everyone. Can you hear me? Happy Saturday. Can you hear me? Can you hear me? Put a one in the chat if you can hear me. We are streaming on YouTube, Facebook, and Rumble today. We have successfully connected to all three platforms. Hello, everyone. Hi, how are you? Hope y'all are doing great. I'm in better spirits today than the last time y'all saw me, because last time I was dealing with the pollen and whatnot. But happy Saturday to y'all. Thank y'all for coming through. Mara, I don't want to butcher your name. Well, happy born day to you, Maragan. How are you? Hope you are doing well. Good to see you. Yeah, I remember you. Yeah. I hope all's been going well on your end. Hope you have been doing well. I haven't seen you in a while. Hey, Just Jay, how are you, sweetie? Good to see you. You double tap. Thank you. Yeah, double tap the screen if you're on the vertical. Shout out to you guys. And yes, happy Mother's Day. This is actually a Mother's Day weekend. So that's one of the great reasons to do this live about breast and how important healthy breasts are, how it can impact our lives overall. Many of you may have had someone that has been affected, and you may not. I'm not sure, but either way, yes, if you're on Facebook, you can support by sending stars. That helps with the monetization on that platform. Sure appreciate you. There's one of my mods. Shout out to you, highly favored. Thank you for coming in, honey. Appreciate you. Hit the like or dislike. Hey, Draco, how you doing? Another mod. Shout out to you, Arabia Barbosa. Westchester County, New York, 914. I probably said that all wrong. But anyway, I appreciate you for coming in. I see you can't stay long. So if you have to check the replay, please check it out. This is going to be very informative. Shout out to you, Miss Baker. I hope y'all are going to have a great Mother's Day weekend. Kiss my cheeks to all the mothers out there. Happy Mother's Day to you. Happy Mother's Day to the mothers of your family if you're not a mother. And those who no longer have a mother in their life or did not have the birth mother in their life. I hope that you get through this Mother's Day as best as you can. As many of you may know, I don't have my mom, my birth mom. I call my mom is Mama Sandra. She helped to raise me. She's I know she's over on Facebook for sure, but Mama Sandra has been in my life since my mom actually passed away. I was around 8 years old, so I do know how that can go as well. Whether you have a mother figure, please, show her your love, your support, be there and give her the best Mother's Day gift you can, which a lot of times is just your presence alone. So shout out to you guys. Hey, NC lady, how are you, sweetie? Thank you for coming through. Kobe knows, how you doing? And Royal Ace, I think I got through everyone. Appreciate you. All right, so let's start a poll. I'm going to go ahead and start the poll first here. All right. There we go. I got the poll in the chat. Shout out to you, O Speaks. Thank you for coming in. Breasts are important to both men and women. a lot of times it is a misconception, but I am going to focus primarily on the women. As a nurse, I have had to help patients who have dealt with breast concerns. There are different breast concerns. There's not just one type of issue with breast that we're going to go over. And yeah, shout out to you, Miss Melanie. Thank you for coming in. Anyone that I have missed on the playback or while you're coming in and I'm going over this presentation, charge it to the brain, not to the heart, because I'm going to be focused. I'm going to be zoned in on what we're talking about here today. So shout out to you guys for coming through. Let me make sure that is set up. Okay, so I know I'm trying to make this about an hour long. I'm not gonna try to go too like into it like that, but we are gonna get into the different concerns when it comes to our breast. Shout out to you, Miss Eve. Thank you for coming in, sweetie. My New Orleans sister from next door. That's my next door neighboring. Y'all hear Corey Holcombs, he says backdooring. That's my next door neighboring. Shout out to you guys. So let me go to our first clip. Share the screen. Let's go here. Let me know if you cannot hear it in the chat. I think I have everything set up. Hey, Roy Lee. I think I see Roy's name in here. I don't know if I passed him up. Oh, I see Royal. Okay. Shout out to you guys. If you can't hear it, please, I'll be watching the chat while this plays just to see if y'all can't hear it. But here we go, y'all.
Let's get started. Step 1. Stand in front of the mirror and check your breasts for the changes including change in your breast size or shape, thickening of the skin in the breast or underarm area, swelling, warmth, redness or darkening of the breasts, dimpling or puckering of the breast skin, an itchy, scaly sore or rash on the nipple, pulling in of your nipple or another part of your breast, or pain in one part of the breast. Step 2. Now raise your hands and look under your breast.
Okay, guys. So this is a step-by-step of how we should be checking our own breast every month. If you haven't been doing it, it's never too late. Go ahead and get started. If typically if you've already you're menstruating, you'll want to wait because you're going to have some changes during the hormonal changes that go on during menstruation. I think they want you to wait about a week. But if you're not, you can check them at any time. If you're gone through menopause and you are completely through menopause, not peri, because peri you still might have menstruation. It might not be frequent. But just know that you will see some changes in your breast during your actual menses. So,
for the same changes. Also feel for lumps or hardness in this area. Step 3. Next, check your nipples for any discharge or fluid secretion. Nipple discharge may be watery, milky, yellowish, or even tinged with blood.
Yes. So if you have any discharge, you should definitely go see a doctor right away. Having discharge is a concern. because you should not have any discharge unless you are lactating. And so that is a big red flag if you are having any discharge from your nipples, your breast. Okay?
And should be checked immediately. Step 4. Lie down on a firm surface on your back and using slow circular motions, feel your breasts for any kind of lump. Follow a pattern to be sure that you cover the whole breast. You can begin at the nipple, moving in larger and larger circles until you reach the outer edge of the breast. Check the inner part of your armpit as well.
That is so very important that we check the inner side of our under armpits. A lot of misconception is that's not a part of the breast, but there are a lot of glands, and we have lymph nodes that, of course, go throughout our entire body. So you want to check under your armpit for any swelling, any hard tumors, type nut lumps or masses that you haven't seen before. Okay. So definitely check under your armpit. Just don't keep it to your breast itself. You need to check under the armpit as well. That is a place that a lot of people forget to check when they're doing their own self exams.
Always use opposite hands to check the breast. Step 5. Stand up and repeat the same circular motions from step 4 across each breast. Step 6. If you detect anything suspicious in either of these steps, don't panic. Make a note of your findings and schedule an appointment with your doctor immediately.
Yes, if you find anything different, if anything has changed from 1 month to the next, where you feel something that's out of sorts, it doesn't feel right, it wasn't there last month when you checked, go ahead and contact your doctor. It does not mean that you have the worst case scenario. A lot of times we might freak out because it's, oh, this wasn't there. Like, well, the earlier the detection, the better. It might be something totally benign. And in a lot of cases, it can be. So I'm not a doctor. I'm not giving medical advice. I'm giving you advice from me working as a nurse, what I've seen, what I've learned just as being a woman. You know what I'm saying? So you need to verify all this with your physician, because I'm not your physician. But doing self exams is something that we should be doing, just like men and women should have their reproductive organs checked at a certain age. That needs to be done every year on cue. Like, that just should be a given after 40, especially 40, 45, unless you have family history of any problems that they've had, maybe some cancers run in your family, then your doctor might say you need to get checked sooner. Okay.
If everything seems okay, you can be at ease. But remember to conduct this examination every month. But do keep in mind that you do it after your periods are over. Those who are not menstruating can do it on an assigned date every month. Remember, cancer is not the end of the world. In most cases, women who are diagnosed with breast cancer survive and lead healthy lives, especially when detected in time. Keep your date with your gynecologist or breast cancer specialist for an annual preventive breast exam.
Yeah, and like I said earlier, we need to check every month. Your health is your wealth. You get to choose how you want to live this life. We got to choose our own fate. And whether we choose to go or check yourself, then that's on us at the end of the day. Most of us are grown. You have the choice at the end of the day. No one else is forcing you, or no one can force you to get checked, to check yourself. You know, that's your body. Just like people say, it's my body, my choice. Well, it's your choice to make sure that it's also healthy. You got to make the choice at the end of the day to make sure your body is healthy. You need to go to your annual checkups like they mentioned in the video. You need to get them done every year, or sometimes people go twice a year, depending on what your health status is. That's between you and your physician. So it's very important that we get checked every month, regardless if you're, for women, you need to check yourself every month. Men and women should be getting their annual checkups once a year, at least. That way, you know, okay, this wasn't there last year, or this is there here this year, and I need to make sure I take care of it. Because earlier the detection, that's how a lot of folks who have had any unhealthy results, they can get it nipped in the bud right away. And a lot of times it can be resolved. You won't have to deal with long-term, issues from any health scare if you get it checked earlier. A lot of times, what happens is we get checked too late. And if it gets into stage 4 or metastasis in the case of cancers, then that can be a concern, right? Because it's harder to treat the further we wait into an issue. So Mother's Day, y'all go tell your mom, hey, or just check on her, because the older we get, the higher our risk are as well. So ask mom, hey, mom, you've been going to your doctor, or y'all might already be talking to your doctor. So, or your mom goes, you might be the one that takes her to her appointment. So that's even better. You're involved. You're making sure, hey, mom, my mom is straight because I'm the one that takes her, or I know who takes her. She takes herself, especially up in age when they no longer can drive like they want to or whatnot. So anyway, so let's go to the next, I'm going to go to the next video. Okay. Y'all make sure y'all are doing the poll. Be honest. I just want to see where folks are with getting their annual breast exams. So that, like I said, that's important because it's definitely a concern within, the gender of the female gender. We need to be getting our exams. So what happens when we have unhealthy breasts? There are different types of health issues that can go on with the breasts. So I'm going to go to the next exam.
Examining the breast both in the seated and the things to remember in doing the breast exam, particularly if your patient has a breast concern, breast tenderness, or she's felt a lump or a bump. Examining the breast both in the seated and the supine position is important. Checking all areas of the breast, checking the axillary tail of Spence is important, checking for any axillary lymph nodes and also any infra and supraclavicular lymph nodes as well. So the area that is tender, can you show me where it is?
Yeah, it's kind of the upper right side.
Okay, so this lady probably did her own exam. This is all for the sake of teaching, right? So this particular lady probably did her own self-exam, and she found some tenderness. So she's going to the next step, which is to go to her physician. Okay. So that's why I said doing your own exam, because you know your body yourself. You need to say, hey, I felt something weird. So now you're going to get the physician, the professional, to check.
On the right side. Okay. So the first thing I'd like to do is I just want to observe your breasts. I'm looking for any dimpling or changes in the skin at all. So I'm going to have you do a series of maneuvers with your arms, and I need you to have your gown be free. So I am going to let you pull your gown out from under you. Good. And then if I can untie your gown.
Oh.
Is that okay? Or you can untie the gown? Yeah. And do you mind untying that one as well? All right. So I'm just going to open your gown, and I'm just looking at your breasts, looking for symmetry to be sure they look the same.
So this is what the physician's going to do. They have to look at the breast. So that's just a part of the routine breast exam. So they're going to look at the breast, make sure they're lining up, looking for anything that's out of shape, anything that doesn't fit. They should be symmetry. And they're not always going to be lined up correctly, so don't get that twisted. Breasts usually are not going to be lined up the same, like as far as how far down they go. Okay, you're going to have some probably minor differences, but it shouldn't be so significant to where it's a concern, basically. That if that makes sense to y'all.
On both sides. When I'm doing the exam, I'm looking for any changes in the skin, any dimpling of the skin, any asymmetry between the breasts. I will want to check for any nipple discharge and ask about nipple discharge as well. So examining all parts of both breasts. One of the concerns that your patient may have is with breast tenderness, redness, fever, thinking about a mastitis. So particularly.
So as you see here, that there are other concerns to look for. There's not always a lump to look for. You have this particular picture. This is mastitis. A lot of times I've seen this in nursing mothers, if they get clogged ducts or an infection as they're breastfeeding. This is not uncommon for a mother postpartum to experience this type of health issue.
A patient who's postpartum and nursing, a mastitis is not rare. Your findings on exam would include erythema. You will check their temperature and see if they have a fever. You will check the temperature of the skin and look at the skin, looking for redness. You do want to think about the possibility of a breast abscess compared to just a mastitis. It's often really hard to distinguish between the two. The breasts are often pretty equally tender, and an ultrasound will help you determine if there's an actual abscess cavity that may need to be drained as opposed to a mastitis.
Yes, so as the doctor mentioned, she's looking for discharge. Yes, there can be discharge when there are any infections, typically within the breast. It's not uncommon, of course, when a postpartum mother has just given birth or she is still breastfeeding. You're, of course, going to have lactate discharge. Of course, the milk is coming through. That is to be expected, right? We're talking about pus, blood, things of that nature, other discharge outside of milk, especially for a mother who is breastfeeding. But in the case of someone who's long past given birth and whatnot, there should be no discharge whatsoever. I'm not saying that it doesn't happen, because there are rare cases where women who have long given birth and are no longer breastfeeding, they have the rare cases where they are still discharging milk. So they just have an overproductive gland, is from what I've been told. But yeah, that can happen as well.
I'm going to ask you to raise your hands up over your head, like so, way up high. Good. And then if you can put your hands on your hips and press down a little bit. And if I can pull your gown back just a little bit here. Excellent. And then I want you to just rest your hands in your lap. And I'm just going to check one side at a time. Try to warm my hands up a little.
So now she's done the visual inspection. Your physician should then go on to do the actual physical inspection. Like she's already did the visual. Now she's going to physically have to touch the breast, which if you want, you can have a chaperone if you don't feel comfortable. A lot of times they automatically have a chaperone with you because it's important for your peace of mind and for you to also feel safe. If, you know, whatever, it doesn't matter if it's a woman or a male doctor. That way they have someone who can attest to what type of exam they performed. And if there was anything done that was inappropriate, they have someone who witnessed it. So it is not uncommon for a chaperone to come in. It's usually a nurse, or it can be a tech. It might be a CNA. It could be anyone who's in the medical field that can come in to help the doctor. That way they're just there basically as to chaperone and make sure that you feel comfortable and safe with whoever is examining you.
Okay. So I'm checking the area up here underneath your arm. There is breast tissue that goes up there underneath your arm. And I'm also checking to see if there are any lymph nodes enlarged there. And I'm doing it in a systematic way. Do you check your breasts?
Yes, I do.
Okay. When I do an exam, the sorts of things I'm paying attention to, if the woman herself has felt a lump, I want her to show me where she feels that lump, to describe if that has changed at any point, to tell.
So see, with this particular lady, she has done her own exams. That's why she knew there was something wrong, something felt tender. Now, if she had a trauma to that area, that may be the reason why she has tenderness, but it's better to be safe than sorry and go get it checked out by a physician. That way you have your, fears put at ease, or you can address whatever it is, if it is something, you know what I'm saying? So this list over here is telling you what the physician is looking for.
Tell me if it's tender. It's not too common for breast cancer to be tender, although it's not an absolute rule. But something that would make me worry more about a breast lump is if it's really firm, if it's fixed to the skin, if it's really rock hard, and if it's irregular. A breast cyst is often pretty regular, feels a little smushy. In a young woman, a really common breast mass is a fibroadenoma, and that feels a little more firm and kind of rubbery, but again, very regular. And it's not rare to have more than one fibroadenoma, so examining carefully for all areas of the breast. So far.
So as you see, they had the list here. Let me see. Of all the things that okay, they had the list over here right there, I think. Okay, there's the list. Okay, so that's what she's looking for. Let me see if I can remove the excuse me, y'all. Oh, there we go. All right, so this is what the physician's looking for. These 6 items. Are these items or these concerns there? Okay, so that's what you should be looking for when you're doing your own breast exam.
The breast. So far, I'm not feeling anything to worry about. I'm going to pull out the end of the table. If you can lie back. And if you can put your hands behind your head. And it's the side that's a little bit tender.
Yes.
So I'm going to start by checking the other side. I'm just being systematic and checking all the areas of your breast. There's lots of different ways to do that. Some people will go around in a circle. Some people will talk about wedges of the pie. Some people talk about the lawnmower method, going up and down. And actually, there's maybe a little bit of evidence that the up and down vertical method is a good thing to do. So I'll examine in that way when you're lying down.
Okay, so see the different ways you can make sure you're examining your breast. She said this lawnmower method is the best method. I didn't know that. That's news to me. This is from Stanford Medicine. So this is the method she's saying that is best, which, like I said, there's always new information, especially in medicine, that's coming out. That's why it's called practicing medicine. A lot of people don't get that. Words matter. So they're practicing medicine. So we learn new things as we practice, right? Practice can make perfect, hopefully. So anyway, this lawnmower method seems to be what she's saying is the best method to use to go up and down the breast instead of in the circle, which this is the method I was taught as a young girl, but I've never heard of the wedges method. But anyway, so she's doing the similar exam, but from a professional standpoint, okay? So that's why it's important to go to a physician, especially if you feel something different. I'm not going to continue this particular video. You can definitely check it out yourself if you'd like to. I'm not going to put, because she's doing the same exam, but from a professional standpoint, okay? So she can tell things differently than what a layman would, okay? So that's why it's important to go. And then she may order any additional testing that may need to be done just to double check her findings, okay? So let's go to the next video. Let me set it up. That video loves to play. Okay. All right. So now we're going to the next phase. So you've done your self-exam, then you've went to your physician to do their own exam, right? So here's the next step. Let's say Mrs. Johnson, who I'm just making up a name. She went to see her doctor after her own self-exam. So the next step is, let's say that doctor said, you know what, I do feel a concern. Let me go ahead and send you for testing. Okay. This is typically the next test you're going to have done if need be.
A mammogram is an X-ray of the breast. It looks for early changes that could be a sign of cancer. The radiographer positions one breast at a time between two flat plates on the machine. This compression helps to give a clear picture. The radiographer takes the X-ray from behind a screen. This is to protect her from the radiation because she is taking X-rays every day.
Okay, so as you see, the test is done with this machine. You do have a tech that helps to do the actual mammogram. This is not a physician. This is a tech. There's a big difference. Who reads the test is going to be a physician. They're the ones that study images, just like a radiologist, just like someone who looks at MRI scans. Those are physicians. They're the only ones that have been trained for the eye and to know what to look for. You know what I'm saying? They know what kind of disease, or they know what type of structures to look at, things of that nature.
The radiographer takes the X-ray from behind a screen. This is to protect her from the radiation because she is taking X-rays every day. They take two pictures of the breast, one from above and one from the side. Then they X-ray your other breast. Some women find mammograms a bit painful, but most only feel mild discomfort. Either way, it doesn't last for long.
That's perfect. She said it right. It does not take very long. It might take you 5 minutes. You might be in the waiting room longer, waiting to go to the back to get the exam done than you are for the actual exam. Okay. Mammograms typically need to be done once a year after, I believe, 45. Now they might have you go every year, and it may be 40. So double check that. But anyway, your doctor might tell you you have to start sooner. Like I said earlier in the live, if you have a history, especially in your family, of any past breast issues or cancers, things like that.
Your mammogram goes to a specialist radiographer or doctor to look for changes that could indicate a breast cancer. You should get your results within a few weeks.
Exactly. So usually I get my results within a day or two. It doesn't take long at all, depending on what time you go. Yeah, you're going to get your test results quickly. It doesn't take as long as it used to in the yesteryear. So it's definitely important to get done. You know what I'm saying? Like I said, it's your health, your wealth. You choose what you want to do with your health. At the end of the day, we're the ones responsible for how we choose to live. So next, we're going to go to a biopsy. This is the next step. If let's say your mammogram comes back positive, you might need to go get additional testing. So I'm just going in the order of what usually happens. I'm not saying this is across the board, because you might get an ultrasound before a mammogram. It just depends on what's going on. So this is a typical routine of if things need to progress down the diagnostic stage. Okay. It would be good if I share the screen, right? Thank y'all for joining me. Happy Saturday. Happy Mother's Day weekend. All right, I think we're here.
As the X-ray images show a few areas of concern. You need a breast biopsy, a common procedure used to determine if certain areas of your breast are cancerous. You may be filled with fear, worry, and anxiety, but you also want to be prepared. So what can you expect if you need a breast biopsy? Let's start off with some good news. More than 1 million people receive a breast biopsy each year, and approximately 80% of the results are not cancerous.
So again, this is not to put fear. This is for awareness. This is for awareness. Okay. To be aware is to be knowing what's going on with your body. That's your responsibility. That's my responsibility. We are responsible for what's going on with our own bodies. And that's your choice. Again, your body, your choice. So, like she said, a lot of times these biopsies are negative. So it should be reassuring to you, because our bodies are going through changes every day, regardless if we want them to or not. Your body is going through changes. You're going to age. That's a part of life.
A breast biopsy is a minimally invasive procedure that removes a sample of your breast tissue for testing, and it can result in some minor pain and downtime. Certain factors like the size and location of the suspicious area will determine what type of breast biopsy you'll need. Most, but not all, breast biopsy procedures follow the same steps. Here's a closer look at the general process. Depending on what kind of biopsy is recommended, you will receive some form of anesthesia, such as local anesthesia to numb the area so you won't feel pain. You will be aware.
Okay, so they give you numbing medicine before they draw from whatever they found. It could be a mass of some sort. It could be a collection of some type of tissue that they draw out or they remove, just so that they can study it. Because then they'll send that on to a pathologist, and that pathologist is another physician who studies pathology. So just know that that's the steps. So it's not, it is a little painful. I'm not going to sit here and be like, it's not painful, but that's why they put the numbing cream. You're probably down for a day. Like, it's an outpatient type of procedure. Okay.
Wake during the breast biopsy. Your healthcare provider will use some form of imaging, such as mammogram, ultrasound, or MRI, to accurately pinpoint the area in question. They will then make a small incision on your skin and remove a sample of your breast tissue with a needle or vacuum-powered device. Once the tissue is removed, your healthcare provider will place biopsy markers inside your breast. These very small metal markers or clips help locate the area if surgery is needed.
Yeah. Okay. So it looks like they even add markers to it. That way they know the area of concern. So that's good to know that they're actually looking at that area specifically to make sure, okay, we need to come back to this area if we need to follow up.
It can also help radiologists see where you had your biopsy during future mammograms. The incision is then closed using either a sterile bandage or adhesive strips. The whole procedure takes anywhere from 20 minutes to an hour. In most cases, you'll be able to return to your normal activities the same day and may experience some discomfort. Make sure you follow your doctor's post-procedure instructions. While you recover at home, a pathologist will examine the tissue sample under a microscope, perform any necessary tests, and report their findings to your healthcare provider. It can take up to 2 weeks to receive the results.
So it's different than with the mammogram because there's more in-depth examination of the tissue. Okay. So they're looking in more depth. They're sending it off, kind of like when people do toxicology reports. Those can take up to 6 weeks. I'm not sure if y'all knew that. I've not heard of it being any sooner, but this taking up to 2 weeks is not uncommon for pathology studies to come back.
Whether your results are negative or positive, don't hesitate to ask questions along the way. Needing to have a breast biopsy doesn't mean you have cancer. It's an important tool to help determine if cancerous cells are present and can help your healthcare team determine next steps.
And that information is from the Cleveland Clinic. They are very well known as far as doctors using their information for passing information on to their patients, because they do research. And so it's a reputable entity as far as medical procedures, medical diagnosis. You can go to Cleveland Clinic, their website, and find out information that is straight up, it's legit. Okay. We're not just gonna go online to even WebMD. I don't like using that website if I need to look into disorders, diseases, any type of other issues. I usually go to a reputable site like Cleveland Clinic, Mayo Clinic. They're another one I use if I need to find out legit information. Shout out to KTC. Shout out to you. Shout out to you, old school. I'm just looking at the chat for a brief moment because I don't want to go too long in this. Lovey, hey, shout out to you. I think I spoke to Miss Melanie. Oh my God, they're gonna have a hard time. I've heard this before. Putting my little boob in the machine. My appointment's coming up. Okay, awesome. See, no, your boob is not too small. Trust and believe. The way the machine is set up, it can accommodate. Uncle L, shout out to you. No, the radiologist, a tech cannot provide the data. Now they cannot, let me say it this way, Uncle L. They can tell you what the doctor said about the results, but they cannot read the results. They're not licensed or certified to read radiology images. Okay, that takes time. That takes a lot of studies to be able to learn how to read any imaging. Okay, shout out to you, Nurse Petty, a fellow nurse. Shout out to you. Thank you for coming through. Like I said, happy Mother's Day to those who are moms, and to your mother if you're not a mom. You know, happy Mother's Day to those who have acted in the place of moms, to the aunts, the cousins, the nieces, the aunts, and the stepmoms, I wanted to say, and those who have acted as mothers, even if you're not a mom. So happy Mother's Day. This is my Mother's Day weekend live, and I just wanted to focus on women's health because it is important that we get ourselves checked. There's no reason, especially in the country that we live in of America, and anyone who's not here, we have too much access to go without getting our checkups. Okay, so let's go to the next video. Shout out to everyone that is over in Rumble and those who are on Facebook. Appreciate you. If you sent any stars, I'm sorry, I don't have multiple devices to check if you are watching. Okay, so this one is a short. This is from a breast surgeon. Okay. And let's see. Hey, Solstice, shout out to you. Shout out to anyone over on the other platforms. I appreciate y'all for the view. Hit the like or dislike, whichever you prefer. Now, this is about dense breasts, which is not uncommon, okay? Dense breasts are not uncommon, especially as we age, all right?
Hi, I'm a breast surgeon, and did you know that your breasts are made of...
She's going, I put her too fast. She's already talking fast enough.
Three things. The first is glandular breast tissue. That's the bit that produces... Hi, I'm a breast surgeon, and did you know that your breasts are made up of three things? The first is glandular breast tissue. That's the bit that produces milk when you have a baby. The second is fatty tissue, and the third is the fibrous tissue that kind of holds it all together like scaffolding. In your 20s and 30s, you have dense breasts. You have an awful lot of dense glandular breast tissue and only a little bit of fat. As you reach your 40s and 50s, your glandular tissue starts to shrink away and gets replaced by fat, so your breasts become less dense.
Okay, so as you heard, the older we get, the less fat, okay? That means gravity might be taking place, or you just, because of what happens over time, we lose that.
By the time you reach your 70s and 80s, there's barely any breast tissue left, and your breasts are mainly fat. This means your breasts are no longer dense.
Girl. Okay, so if you've ever heard you have dense breasts, that doesn't mean it's a bad thing. It actually is a good thing because you have what is needed to keep the breast more firm. I'm going to say it that way. Okay. So if you've been told you have dense breasts, don't be alarmed. That doesn't mean it's a bad thing. It just means that your breasts are more firm. So if you're losing the density, then that's just a part of aging. That comes with the territory. Okay. So let's go on to the next video, because I'm just showing y'all the different things. We saw mastitis, which happens a lot in women who have just given birth and are breastfeeding. And then, of course, that can happen at any time, but it's usually during that time. And then we saw breast cancer, those things can, and how they can be detected. Okay. So now this is, oh yeah, I'm already on that video. The one that wants to keep being played. So this is another issue that we can find with breast. Okay.
Girl, don't do it. It's not worth it. I'm not going to do it, girl. I was just thinking about it. I'm not going to do it. I did it.
So as we see, this lady, her breasts were, this was before, right? She used that sound bite a lot of people have used on shorts and TikTok. So as we see here, she even wrote on here before and after, same shirt. Okay. Let me make sure I didn't make the speed up. All right. So
do it. It's not worth it. I'm not going to
see where her nipples were. You got one higher up here, one lower there. So her breasts are what we call enlarged, and they're sagging, and that just happens. That's not uncommon for them to start sagging because of gravity, just like men's testicles start sagging. Okay. Sagging titties are equated to sagging testicles. Okay. So that's why you really, as men, y'all should be wearing what they call them tighty whities, because that will help to reduce that. Like, it's not going to completely remove it, but it might help reduce it, right? Just like bras do for women who have large breasts. So as we see here, her breasts are not even, and her nipples, of course, are going to be in different places.
I'm not going to do it, girl. I was just thinking about it. I'm not going to do it.
So she was talking about she's not going to do it, but we know that's just a soundbite from someone else. Anyway, she's going to do it.
I did it.
Okay, look at the huge difference. She got a reduction done, and she got breast lift, no implants. So she had hers lifted. Okay, that's one way to fix this problem, is to actually get a lift. Okay, we're going to look at a second method that can help with these lower sagging breasts. Okay, so we got one. Let's look at another method. Shout out to you guys. Thank y'all for coming through. Happy Mother's Day weekend to anyone who celebrates. And we're going to share this video. All right, let's get to it.
If you feel that you have a too big breast, the reason is because of genes. So probably somebody in your family gave you these genes of gigantomastia, bigger breast. And also, of course, you can have a big breast if you put on too much weight. So the fat that you have in the breast will expand and will increase the size of your breast. So don't worry, the solution is breast reduction.
So like he said, it's a lot of times genetic for people to have enlarged breasts, or I forgot what term he used, gynecomastia. Let's hear that back.
Tomastia, bigger breast.
Gigamastia.
And also, of course, you can give you these genes of gigantomastia.
Okay, he said gigantomastia. I know I'm butchering that word. Anyway, big breast, big boobs. Okay, so if you have big boobs, that's what this word is what they would diagnose you with. Okay. And like he said, it's from genetics or from putting on weight. Everybody puts on weight differently. Okay. Some go to the breast and they probably would like that, right? Of course, to a certain extent. And then some go to the stomach, the hips. It can go to the face. You'll see the face get larger. Everybody's different based on their genetic makeup. So if you're putting on weight, it could go to different areas. And some people, that just goes to their breasts. You've even seen men who formulate breast over time because they've gained so much weight, they end up with gynecomastia or gigantomastia in their breast. Okay. So they call them moobs for men, right? Instead of boobs. So they would be called moobs for men. Okay.
A bigger breast. And also, of course, you can have a big breast if you put on too much weight. So the fat that you have in the breast will expand and will increase the size of your breast. So don't worry, the solution is breast reduction.
Let's take a look at this incredible breast reduction transformation.
All right. So next up is, it's going in order now. Thank goodness. Is the breast reduction. The breast reduction, sorry, y'all. Before and after, right? This lady has a humongous breast, y'all. So that's just what it is. There are some women who have naturally enlarged breasts, okay? So that's just a part of life. She looks like she's overweight. She probably gained a lot of weight, and a lot of her weight went to her breast. And of course, gravity takes its place, and her breasts have come down. So we're going to listen to this surgeon. He's a plastic surgeon. I like to watch a lot of his reaction videos.
Take a look at this incredible breast reduction transformation. Here's the before and here's the after. Congratulations. I hope you feel amazing.
That is huge difference. Look at hers. Like, she went from this and I don't know if this is a bra or not. It looks like it could be. And then she went from that to this. So what a weight off of her shoulders, literally, right?
I hope you feel amazing. You look amazing. Well, breast reduction surgery is very common. It takes about 3 to 4 hours in general. It is performed under a general anesthesia, so you're completely asleep. And my patients usually start to recover within about a week or two and start exercising after 3 weeks.
So there you go. It's a week or two, then 3 weeks. So that's not bad. It has improved over time. So let me just go over why someone would want a breast reduction, because I noticed they didn't really get into that other than weight loss, weight being an issue. And of course, we can't help our genetics. That's a part of life, right? So one reason why is because, and I found this on a plastic surgeon's website. Let me get the name of it because I like to provide references. So, where is it? This is from Harris Plastic Surgery, Cosmetic and Reconstructive Plastic Surgery. So that's the name. I don't know if y'all can see it. But anyway, I'm not going to read all of this. But what qualifies for medically necessary breast reduction, okay? A lot of times it's medically necessary because of neck and back issues. Enlarged breasts can cause neck and back issues, which can be very concerning. If just imagine having this weight on your shoulders, literally, it's pulling you down. You see this lady here in this video, all this is weight. She probably has like 10 pounds right there, maybe more, just pulling her down. And it creates issues in posture. So that can be another medical necessity for getting a breast reduction. It's affecting the posture, causing you to either overcompensate, or it may cause you to have your back fold in like that because you're carrying all that weight around your back. Now, it can also create nerve issues, okay? Nerve issues. So you imagine extra fat and whatnot impinging the nerves, so that can create that issue as well. Then skin issues. I don't have oversized breasts, and not to say that I wouldn't have liked extra breasts. I'm probably considered in the what they call little bitty titty committee. I remember them saying that back in the day, back in our middle school, high school time, little bitty titty committee. Anyway, nerve issues, skin issues. So the fold typically underneath can create issues. You can have where underneath the breast they get frequent rashes. They can get what they have under there. They end up having a bad odor. And so that can be a medical reason for your insurance to cover your breast reduction. Okay. So there are ways to get a breast reduction under your medical insurance. You would, of course, have to go through your doctor, and then they would have to send the referral and get you approved through that method. So just know it's not considered cosmetic if it's creating medical issues. Okay.
Now, health insurances usually do cover this operation, but you do have to usually jump through certain hoops. You have to have breasts that are a certain size. You have to have symptoms like back, neck, and shoulder pain, and sometimes rashes. Now, I want to let you know that you look fantastic. I hope you feel that way too.
You're at your
And like the plastic surgeon said, you have to qualify. He said there's some hoops, but it's worth it if you really are suffering, because I have family members who they were, I'll say, they were blessed with big breasts. But, if it's creating issues that makes it difficult for you to sleep, you to live, you to walk, a lot of times it might cause you to lean forward more, so your posture is going to be off. Okay. So that's another reason why medical insurance will usually go ahead and pay and cover for those type of procedures. Okay. And then here's the last video, and then we're going to open the floor up. If someone wants to come up and talk on it, I'll give a couple of minutes or 5 minutes to do so. The link is in the chat. I think the link is in, I don't know if Facebook, I have to look at that next time. I don't know if I put the link for StreamYard there. I think I forgot to do that. My bad. But if you want to come to YouTube and I have the link dropped, I don't have it dropped in Facebook or Rumble. My apologies. All right, so let's go over this young lady in Houston, Texas. Okay, let's see what she underwent. I think this was historical from what I was watching earlier.
Surgeon says the largest breast reduction of his surgeon says the largest breast reduction of his 30-year career was a success. We brought you Renee Lawrence's story last week. She was an O cup, believed to have had the biggest breast in Texas. She was desperate for help and
an O cup, y'all. I've never even heard of an O cup. Have y'all? I've never heard of an O cup. And she's a beautiful young lady. I'm just like, you could tell, look at the arch in her back, how it's creating that arch in her back. That can be painful for the back to have to deal with the heaviness of an O cup. I could only imagine. I can't even imagine. Like I said, I'm not a part of that committee, but I can only imagine what she went through, just struggling with that back pain. I've never heard of an O cup.
Thrilled she was able to get it. She joins us live post-op. Good morning to you. You got to bring us up to date and let us know how you're feeling.
Good morning. I feel amazing.
That is great to hear. Now, when I got to talk to you before your surgery, you had a huge smile just thinking about it. Now I see a big smile afterwards. How'd your surgery go?
It went pretty good. It was maybe around 3 to 4 hours. My recovery, like as soon as the surgery was over, went home, just been resting. And I don't have like really any side effects, just soreness. And I've just been relaxing, taking it easy.
Oh, that is great to hear. We're right now taking.
So see, she's taking it easy. She'll probably be down, like the other surgeon said, for about 3 weeks. And it doesn't mean you're down. You're just having to recover. That's a lot to deal with. Imagine having pounds of flesh removed from your body. Your body has to go through a lot to adjust to that change and transformation. So as we see, here's her before and here's her after. She looks like I said, literally a weight's been lifted off of her shoulders, because you imagine walking around with these jugs. Like I couldn't, I don't even, carrying a baby around to me was a lot. Just walking around with a baby, or the extra weight of being pregnant, that's a lot by itself. Now to look at this, and this is something you don't outgrow with babies. Eventually they get off your hip and you're not packing them around anymore, right? They're no longer in your tummy. You don't have to deal with the weight. But this lady may have just been, granted these from genetics. These are her genetic traits to have the big bosoms, you know what I'm saying? And she had to carry them around for life. We don't know. I don't know what her story is. Maybe she'll go into it.
Taking a look at your before and after. I don't know if you can see it, but I know you remember all too well what it was like. Tell me the difference, what you're feeling the most, because I know this was physically painful for you, for your chest to weigh so much.
Absolutely. I definitely can feel the difference. It's definitely not so much weight in the front. I actually went a little bra shopping, so that was really, really a great experience, because I was able to just fit into bras I was never able to before. But just the feeling, I just feel so so much weight lifted off my chest. I actually feel just like I could sleep pretty good, and I don't feel like the normal sweats or just what I was feeling before. So I really feel amazing.
I would have to say I could agree, because it just looks like she's like healthier, she's happier, she's not. I just couldn't imagine that has to be. And there are women who go out and get her size. You know what I'm saying? There are actually women that will go out and get up her size, or try to even get more. I don't know if there's even more than an O cup. If there is, I'm sure there's someone out here that has posted their videos of having a bigger size than an O cup. I'd have to look into that. But anyway, this is the biggest reduction in his 30-year career. I want to say they said this was a record, not just with this surgeon. So, and she's sleeping better. She's not having to deal with the issues of sleeping, like having just to turn over in the bed. That's a lot to deal with. And I don't know if they made a bra her size for her.
Really do. And I really thank Dr. Rose for doing this transition for me.
What a blessing for you to be able to tell us that, and to see how far you've come. Now, I understand you've already been bathing suit shopping as well. Tell me what that was like. And are you feeling more confident about the way you look?
I really am. I was standing there, like, I was just looking like this really happened. Like, I just felt so overjoyed. Like, I don't know. I just felt like that, like this was never ever going to happen for me. Like I was just like, I'm just gonna have to keep suffering and just going that shopping and looking at suits that I can comfortably just put on, going in the dressing room and just putting them on just made me feel so good. Like,
and I could imagine that this helped with her self-esteem, being able to wear regular, which, you know, I hate to use that word, but average size C, D cup. I don't know what cup she went to. I don't think she's mentioned it yet. But to be able to bra shop, she might have been like Shaq. You know, Shaq had to have special shoes made. She probably had to have specialty type of bra, or maybe she wore something else in place of a bra to act like one, just so she could live a natural or normal, somewhat normal life. You know what I'm saying?
It was just an amazing experience to look at, like from where I was to now, and to be able to just put it on and just trying them on, turning around in the mirror. It was amazing.
Well, this is something very private, and I think it's impressive that you're able to talk so openly about it, because I truly feel like you can help a lot of women. We've seen so many women come forward now and say, I was going through something similar as well. I didn't realize I could get help. What are your words of encouragement for others who might be hesitant about undergoing something drastic like surgery?
My words of encouragement would be, you know, to do it. If you feel like you can, just like I was saying, like just do the research. Try to speak with your primary care physician. They usually refer you to a specialist. I would just say, just look into the resources. They are there. It can get covered. You won't have to have a lot of out-of-pocket expenses, and just you will really feel so wonderful, like I do. You'll feel relieved of the symptoms. You'll feel relieved of all of the annoyance and of everything that comes with it, the complications, and you can really, really, really benefit from getting this done and just have I would say, a healthier, better life.
That was an important thing that you brought up, that many times the reduction is not considered cosmetic. It is considered medical, and your insurance will pay for it. And that can make a big difference. Renee, thank you for sharing your journey with us. Continued just pure happiness to you after all you've been through.
Thank you so much.
All right. You look absolutely amazing. Congratulations.
Thank you.
I'm on mute. My bad. My bad, y'all. I just looked. I'm like, I'm on mute. As you see, she seems happier. She is like just Jay said, she looks like has a good spirit. Yeah, I've never heard of an O cup before, so I can't imagine what she was going through. Shout out to you. Hey, Ant Dog, how you doing? Cookie with Foxy. Hey, honey. I always want to say cooking with, use that, you know, that tune, Cooking with Kaya, cooking with Foxy, cooking with Foxy. I was on mute. Am I on mute still? I don't think I'm on mute anymore. Maybe that's a delay. Am I on mute? Let me see. Am I on mute? Oh, okay. Yeah, it's a delay. I can hear myself now. All right. So, okay, yeah. I was talking for a few minutes at one time, but I see the screen is delayed. Y'all probably typed that when I was on mute. Thank y'all. I was saying hey to Ant Dog, Iceberg Thoughts. Thank you for coming through. Yam Sam Man. I also see let's see, Just Jay. She mentioned she's never seen an O cup before, and neither have I. Shout out to Heavy Booze, meaning you have a stronger core. Not necessarily, but you probably right. It could create a stronger core because you got all that up top to walk around with, like all that extra weight up top. So I don't know. And just Jay, I was mentioning, you said she seemed to have a good spirit. She did to me too. I thought she had a great spirit as well. I've never heard of an O cup. Shout out to Cooking with Foxy. That's what I was singing. Cooking with Foxy. Cooking with Foxy. That's your jingle now for me anyway. So Miss Eve says, my sister and 3 of my cousins have had breast reduction. Right. So it can run in the family. It is not unheard of. Shout out to you, Mrs. Baker. I don't know if I spoke to you earlier. Yes, women health, a great topic. I thought it went along really well with Mother's Day. You know what I'm saying? Because we need to take care of ourselves. Even if you're not a mom, we need to do our best to take care of ourselves. So, just wanted to mention a couple of other things I had on here. Make sure you address how to address breast concerns and health, how to be healthy in our with our breast. First, do self-exams. Second, you might be sent to do a mammogram. Okay, that's not unheard of to have to do a mammogram. You also might need to go for your women's well check. You need to do that every year. Okay, this is just a recap. Self-exam, women well check. That's where the physician actually does the exam. And then we have mammograms. If needed, you may end up being referred to a surgeon for either biopsy, ultrasound, additional mammograms. That's not uncommon either. They have other technology that looks deeper or differently at the breast than a mammogram. And then a surgeon for reduction if needed, if that is warranted. And I just showed y'all that sometimes there are breasts that have these excess breast tissue coming out of the sides. That may indicate concern for a breast reduction. If that's a concern, it's causing it may cause you to have problems with walking, with your posture, with also skin issues, as the doctor mentioned. That can also become an issue. So these skin folds, as you see, they can create an issue for women who have overly enlarged breasts. So they may want to go and get checked out to see if they can qualify for a reduction. So that is not unheard of. Okay. So if you need a breast reduction, don't feel like you're being singled out. Okay. Breast reductions are not uncommon to have done. Biopsies, getting checked out, like they said, a biopsy doesn't mean that you're automatically going to have a negative result. It just means they need to look at that tissue or cells a lot closer, more closely. Okay, that's all that means. And what did the clinic say that we watched that video, that 80% of those biopsies come back negative. Okay, so that is important to note. Don't just start fretting and putting out negativity in the atmosphere about having to have additional testing. You're just going to bring yourself undue stress that you don't need. It's not warranted. Wait until you get the results and a diagnosis and then go from there. Like I said, there are studies showing that the earlier the detection, the earlier the treatment, and the earlier the ability to address those issues and maybe even cure whatever you're dealing with. Okay, so that is very important that we do for ourselves. And I hope you guys got something out of this, and that you do what you need to do to take care of yourself, because health is wealth. Exercising, eating well, eating and drinking in moderation, certain things like we talked about last week. You know, we need sugar, we need salt just for our bodies to function, but in moderation. Shout out to you, Via She. I appreciate you for coming through. You're in the clouds multitasking. I appreciate you. Thank you so much, sweetie. So with that said, I'm going to close this out. And I think the meal ticket is live. I'm not sure, but go check him out and I'm going to go take my ass to the gym. Okay. I love going. The weekends seem to be a lot cooler there, even though I go through the week too. It's just not as crowded during the week. So I like that. So let's go out on this note, okay? Thank y'all. Shout out to anyone who sent any Cash Apps or Venmos. I didn't check, but I appreciate you if you sent a tip to the host. I certainly appreciate y'all. It helps for me to put towards my StreamYards and any other things like, you know, media editing type of apps that I purchase. So I sure appreciate y'all. Now let's put some music on. Y'all take it easy. Happy Saturday or Sabbath day for you Christians. Happy Mother's Day weekend again, and y'all take it easy and take care of yourself, and peace out. Let me make sure y'all can hear me. The poll said, thank y'all for answering. I appreciate y'all. Looks like, do you get your annual breast exams? 53% of you said no. 47% of you said yes out of 17 people. That's practically half and half. So if you are a woman Men too should, you know, especially if you got moobs, be checking. This is just a encouragement to make sure you're checking your breasts. Check your breast, okay? Every month we should be checking them on our own, and once a year at least having a physician check them, okay? All right, on that note, y'all take it easy. My apologies for the delay in the poll, and y'all have a good one. Peace out.